Nirav Shah, and I'm the director of the State of Maine Center for Disease Control and Prevention. I'm joined this afternoon with Commissioners Jean Lambrou, Commissioner of Maine's Department of Health and Human Services, and Commissioner Heather Johnson, Commissioner of Maine's Department of Economic and Community Development. And we three are here today to provide an update on the COVID-19 situation across the state of Maine for today, Monday, June 22nd, 2020. Overall, Maine CDC is now reporting 2,971 cases of COVID-19 across the state, representing an increase of 14 cases since yesterday. Of those cases, 2,640 are confirmed and 331 are probable. At present, 27 individuals are currently in the hospital across the state, 13 of whom are in the ICU and 6 of whom are on ventilators. 102 individuals have passed away with COVID-19 and 2,406 individuals have recovered, an increase of 15 individual recoveries since yesterday. I'd like to take a moment to provide everyone an update that we announced yesterday, ongoing in Houlton in Aroostook County right now. Over the weekend, Maine CDC was informed of approximately 7 individuals who had tested positive for COVID-19. 4 of those individuals were EMS paramedic personnel from the Houlton Ambulance Service. Given the potential for exposure among other residents of the area, Maine CDC worked very quickly with our colleagues at Houlton Regional Hospital to set up a testing site at Houlton Regional Hospital for today, tomorrow, and Wednesday. Maine CDC recommends that any individual who came into close physical contact with any member of the Houlton Ambulance Service from June 8th to the present, please call Houlton Regional Hospital to pre-register for testing at that site. Testing is available free of charge and will be offered again today, tomorrow, and Wednesday during designated time periods. We again ask everyone to call Houlton Regional Hospital for 2 reasons. The first is that they can arrange for a specific time that you can drive up, stay in your car, and to get tested. The second is by calling ahead of time, they reduce the possibility of congestion and the possibility of a large number of folks gathering, which of course presents its own possibility for spread of COVID-19. Thus far, I just had a conversation with our colleagues at Houlton Regional Hospital, and they are on track to test approximately 100 individuals just today alone. So again, if you have been in contact with any member of the Houlton Ambulance Service in physical contact, which we define as within 6 feet for at least 15 minutes, over the past 2 weeks, please call Houlton Regional Hospital and arrange for testing during their stand-up testing periods. I'd like to take a moment really quickly to thank and commend the entire team at Houlton Regional Hospital for their partnership and their incredible work in standing up this testing site in record time. Each and every one of the staff there has leaned into this process, and as a result of their quick work, they've been able to stand up a testing facility so that folks in Houlton who may have been exposed can get tested and have their results back as soon as possible. I'd also like to provide a quick update on where we stand with respect to the medical assets that we track every day at Maine CDC. Overall, there are 386 total ICU beds, 139 of which are available. There remain 314 total ventilators, 262 of which are available, and there remain 434 alternative ventilators. I'd finally like to provide everyone a quick update on some of the work that we're doing to improve the visualization of data that are available on the Maine CDC website. Our goal is to provide as much data as we can in a manner that is complete, accurate, and timely. Starting tomorrow, we'll be making 2 changes to the way that data on our website will be portrayed. The first is that for 2 categories of events, hospitalizations and deaths, we will be shifting those representations from the date on which those events were reported to Maine CDC to the date on which our investigation reveals they actually occurred. As you can imagine, as we are notified of cases, we start our investigation. And as with any investigatory process, we learn facts during the course of that investigation that might be different from what we were told initially. Going forward, what we will be doing is making sure that the data on our website historically represent the date on which those events, specifically hospitalizations and deaths, actually occurred, as opposed to what they currently are on our website, which is the date at which they were reported to Maine CDC. A related change that we'll be making, closely related to this, is that we will be going back and refreshing all of the historical data on our website on a daily basis. As a result of that, there might be shifts in things like the counties in which people might live. Again, as we continue to do investigations into confirmed cases, we learn things as the investigation unfolds that refine our understanding of what's going on. Going forward, we will be going back and refining and updating all of those historical data as we learn about them. Why are we doing this? Well, 3 reasons. The first is so that we can be as transparent as possible with respect to how the outbreak is unfolding in Maine. The second is that by making these refinements and these continual improvements, it allows for folks who are downloading the data to have the most accurate data no matter when they download it. And the third is by correcting information as we evolve and learn more. It makes it easier for us to automate a lot of the visualization of data that you see so that we can, again, be as timely, accurate, and complete as possible. Those changes will start going live tomorrow morning, and you'll start seeing them as the updates are being rolled out. Before I turn things over to Commissioner Lambrou, just a quick update on the ongoing missions by the National Guard to fit test individuals. Thus far, our colleagues at the Guard have now fit tested 2,537 healthcare providers across the state for N95 masks, and still have approximately 354 individuals in the queue who are remaining to be fit tested. So with that, I'd like to turn things over to Commissioner Lambrou for updates on the DHHS front.
Good afternoon. To protect public health, the Mills administration has decided to postpone reopening of indoor bar service across Maine until further notice. Under the administration's Restarting Maine's Economy plan, bars across Maine have already been able to open for outdoor service. They were tentatively scheduled to resume indoor services on July 1 in Stage 3. However, as Dr. Shah noted last week, indoor service at bars presents a significantly elevated risk of COVID-19 transmission. Indoor bar service typically features crowds, often in close contact with another, often without tables or other ways of keeping people apart. Smaller spaces at many bars makes physically distancing very difficult. Further, individuals may be less likely to wear cloth face coverings at bars, and in some instances, may be speaking at a higher volume, both of which increase the risk of COVID-19 transmission. This postponement also follows recent reports of COVID-19 outbreaks linked to the reopening of bars in states like Florida, Texas, Louisiana, and Idaho. As Governor Mills stated, this was a difficult decision, but necessary given the increased public health risk and the outbreaks we have seen across the country associated with indoor service. Bars can still provide outdoor seated services to patrons, and the administration has urged the Bureau of Alcoholic Beverages and Lottery Operations to work closely and quickly with any establishment that wishes to do so to expand their outside capacity. To date, Maine has reopened the majority of its economy under the Restarting Maine's Economy plan. The administration continues to monitor epidemiological data, including case trends, hospitalization rates, and reports of COVID-like symptoms. In addition, we work with our healthcare system to ensure readiness and capacity as we think through how to safely and aggressively reopen Maine's economy. Even with reopenings, we urge all Maine people, visitors, and businesses alike to follow the public health guidance to mitigate the spread of COVID-19. This includes wearing cloth face coverings, staying 6 feet apart whenever possible, and washing hands with soap and water often. With that, I will turn it back over to Dr. Shah for questions.
Great. Thank you, Commissioner. We will turn to our colleagues in the media, and today's first question goes to Samantha York from Maine Center.
Hi there. Thank you. I have a couple questions. The first being, is there anything encouraging or discouraging about these new numbers that you're reporting?
Samantha, I'm assuming you're referring to the case count numbers overall?
Yes.
So what we've seen in the recent week or 10 days has been a downturn both in the number of reported cases as well as the number of individuals who have been hospitalized. That is certainly encouraging news. But at the same time, as we've seen in states, particularly in the Sun Belt, there are parts of the country right now that are experiencing record numbers of daily cases. Over 4,000 cases per day just recorded in Florida alone. So for those reasons, although we've seen encouraging trends in Maine, we still remain vigilant for the possibility of an uptick in cases here. For that reason, we've asked everyone in the state of Maine to keep being vigilant. Keep going about your day as if COVID-19 were around you, because what we've also seen is that it is around you. One of the most effective things that everyone can do right now to reduce their risk of potentially transmitting it to others is to keep a face covering on, particularly if you're going somewhere outdoors and in a location, outdoors or indoors, in a location where physically distancing from others is not possible. A face covering is one of the surest ways to reduce the likelihood of transmission. And Samantha, you indicated you had another question as well?
Oh, can you hear me?
Yep.
Okay. Also wondering, I just lost my question. Hold on one second. Are you able to come back to me by any chance?
I certainly can.
Please
In the
do.
meanwhile, we'll go to Brooke Riley from ABC 7.
Thank you, Dr. Shah. So with restaurants and public places kind of running in full swing now, what approach are you taking to contact tracing, and how are you enforcing it?
How are we enforcing contact tracing?
Yes.
Okay. So Brooke, that's a good question. The contact tracing is less about enforcement and more about what happens on the back end at Maine CDC after a case is diagnosed and reported to us. What happens is that as any case is reported to Maine CDC, one of our members of our epidemiology team makes contact with that individual. And we do two things. The first is that we enroll them in our IT system called Sarah Alert that keeps tabs on them and sees how their symptoms are evolving. We also ask them to list all of the contacts that they have had in the past several days, especially those who are close contacts. Those individuals are provided to us, and we similarly enroll them so we can touch base with them to see how their symptoms are progressing as well. We always like to do contact tracing in two ways. The first is try to figure out what the source of the infection might have been. The second is to try to see who that person may have interacted with and passed the infection on to. The Sarah Alert system allows us to do that without needing to have so many individuals on the phone all the time. It automates the process of checking in with folks, seeing how their symptoms are coming along, and if they report symptoms, then allowing us to flag that and be in touch with them on a more particular basis. I am going to turn to Ashley Blackford at WAGN.
Hi, Dr. Shah. I have two questions for you. The first one, when it comes to EMTs, what are the protocols pertaining to protecting themselves from COVID-19 that are in place when they go out on a call, whether they have a patient with symptoms or not?
Sure. So Ashley, one of the things that Maine implemented very, very early on, we can get you the exact date, but it was well before we had a single case of COVID-19 in Maine. We implemented a protocol wherein if someone calls 911 requesting emergency services, the dispatcher asks if the person who's calling or anyone in the household has any signs or symptoms that might be consistent with COVID-19, cough, fever, shortness of breath. That is then conveyed over to the EMS crew that is dispatched to respond so that they can take the appropriate measures. If it turns out that the person who's requesting emergency services has a cough, a fever, and shortness of breath, the EMS crew can respond accordingly with the right level of PPE. If it turns out that the person has no symptoms and may have had a situation that seems to be completely unrelated to COVID-19, they can commensurately have a different type of PPE on. So we implemented that system. It's called the U21 protocol, well in advance of even having our first case in Maine, in anticipation of these exact scenarios.
Okay. Now, in general, say if more first responders test positive, what kind of assistance personnel-wise will be offered perhaps by state EMS?
So we've been working just over the past, let me go back. One of the very first groups that we involved in our COVID-19 planning was the Maine EMS system, spearheaded by Director Sam Hurley, because we recognize the possibility for situations exactly like the one we're working with now. One of the features that exists not just in Maine, but in a number of states are mutual aid compacts, where one city or a number of cities may have a compact with each other so that if a sufficient number of their EMS workers are out of commission for a while, EMS staff from neighboring cities can make sure that that town does not go without EMS. We've already been in close contact. In fact, we had a series of calls over the weekend with the chief of the Houlton Ambulance and Fire Service to make sure that they had everything they needed, in part to activate those mutual response systems and make sure that the people of Houlton don't go without EMS services. I'm going to turn back to Samantha York over at News Center. All right, Samantha, we'll check back in with you in just a moment while we go to Amy Brown at WERU.
Thank you, Dr. Shah. You said there were 7 positive cases with the Houlton outbreak and 4 are EMS workers. How are the other 3 related?
Actually, I'm glad you mentioned that, Amy. I should have been more up to date. As it turns out, there were initially 7 cases that we reported on yesterday. In the ensuing 24 hours, we've identified 2 additional cases, bringing the total number of cases associated in Houlton to 9. One of the individuals was a patient who was transported. 4 are EMS members, and then the others are related to the EMS crews in different ways. For privacy reasons, we're not disclosing the nature of those relationships, but they did have close contact with members of the EMS crews.
And just to follow up to that, I also have a question for Commissioner Lambrou, if I may. But when you were talking about that, also you said that people who've had close contact, and you defined that as you gave some metrics for how that's defined, and I didn't catch that.
Sure, those metrics are individuals who have come within 6 feet of somebody for 15 minutes.
Okay.
One note there, you may recall early on, meaning a couple of weeks ago, a close contact was defined as someone who had been within 6 feet for 30 minutes. The US CDC recently revised that guideline to define a close contact as someone who has been in the proximity of another person, in this case, a COVID positive person, for within 6 feet for 15 minutes.
Okay, thank you. And I think this next question is for Commissioner Lambrou. As it's Friday when people are going to start being able to come into the state, attesting to having had a negative COVID test within the previous 72 hours. Can you walk through exactly how that's going to work? So the people taking the reservation at lodging are just asking them a question, and then do the people coming into the state have to actually sign something? Are there going to be spot checks to verify that people are telling the truth about those things? I see Commissioner Johnson just came on too, so maybe the question's for her. I'm not sure which of you that goes to.
Maybe I'll start, and then Commissioner Johnson can add anything that I missed. So to start, the concept here is that, again, until we have a treatment or a vaccine for COVID-19, we have few tools short of quarantine to prevent people coming from areas with high prevalence of COVID-19 from bringing it to Maine. And as a reminder, when people come to Maine, they often come to visit our lovely towns, to go to our restaurants, to enjoy the state. So we announced a few weeks ago this alternative. An alternative to the 14-day quarantine is getting a negative test result, hopefully with the test taken at home. We urge people to know before you go, meaning if you can, get a test locally, because if you do find out that you're positive, you'd rather quarantine at home. And recently the governor announced or described a story of indeed exactly that case. A couple that was separated, one worked in Maryland, one is here in Maine. The spouse thought it's time to come, went to get a test thinking he was perfectly healthy, and he wasn't. He was able to quarantine at home or to isolate at home as a way to protect his family from contracting this disease. Going to the policy, we are urging all people, either Mainers who go to another state except for New Hampshire or Vermont, people who are coming from those states for seasonal homes, as well as people coming to our hotels and lodging industry, to, again, quarantine here for 14 days if they can, or get a negative test result. There is a form called the Certificate of Compliance that's on the DECD website that is very simple and will include information, including a checkbox of I have had a negative test result within 72 hours, which the innkeeper or the hotel will keep for 30 days as proof that they have really followed this important public health guidance.
And as far as checking to verify that people aren't just saying that?
There is a on the form a statement that says your negative test result may be checked as needed. So there is a system to verify as needed. But we remain hopeful, as we have throughout COVID-19, that people do the right thing to protect themselves, to protect their neighbors, to protect Maine residents as we move forward. This is not about trying to crack down on crime. This is about keeping people safe. And we are confident that people want to come, want to travel, want to visit to safe places like Maine. So we're hopeful that this policy will, as we go on and testing becomes more available, be a positive for tourism as well as our residents in Maine.
Great. Thank you. Thank you. We are going to turn next to Maria Sacchetti, joining us from the Washington Post.
Hi, and thank you very much for having this and for having letting me join this. I appreciate it. I wanted to ask why you're not taking an approach. You sounded very, Dr. Shah, you sounded very upbeat on Friday about your numbers. And I'm curious about why you're not taking an approach similar to Vermont, letting people quarantine before they come to Maine. And then, saying that they've done that when the tourism industry seems very concerned that they're losing a lot of money and won't be able to recover. Thank you.
Mm-hmm. So, we explored a number of different options. When we went down this pathway, all options were on the table. One of the things that I think Governor Mills was motivated by was the security that's provided by having a negative test and having certified that negative test. I think the other important piece here, Maria, is that the testing component and the certification of it are but one part of a series of other measures that are in place. We're working with municipalities with respect to overall enforcement activities, working with so-called health ambassadors to make sure that folks who are coming here have information. So it's not predicated on one particular strategy, but a number of other strategies. We did discuss, again, other alternatives. We felt this was the one that most appropriately balanced keeping people in Maine safe as tourism comes up and still allowing individuals to come here. But I'll let Commissioner Johnson and Commissioner Lambrew comment.
Sure. And I'll just clarify the Vermont policy, because we do look at all of our neighboring states as well as other states to see what their policy is. We're actually fairly similar to Vermont. So Vermont will exempt people from quarantining in Vermont if they come from an area with less than 400 active COVID-19 cases per million. So they have a map that they update weekly that shows it. We also have an exemption to quarantine, which is if you're from New Hampshire or Vermont, which I think is a simpler way of basically achieving a similar outcome. Second, they actually say you can come to Vermont you can quarantine at home for 7 days, but if you come to Vermont, you have to have a negative test. So they have a similar testing policy. Again, we think ours is simpler. We do allow somebody to come to Maine to get a test in Maine and quarantine while they're waiting for the result. If it's negative, then they can enjoy the state like other people. So we think we're actually quite similar to Vermont. But I think what we recognize is Maine is different than many other states. Many people come here by car from areas where COVID-19 is prevalent. We know that people travel the coast, so they go from town to town to town. We know our numbers are much bigger, frankly, than New Hampshire or Vermont in terms of tourism. So we feel it's prudent, given the fact that Maine has been successful more so than any other eastern seaboard state in keeping the prevalence of COVID-19 low. Our goal is to keep it that way and attract visitors who want to come to a safe state.
Just to add in there a little bit, one of the things that we continue to do is look at other areas to see other areas in prevalence in other areas to see if there are areas that we can add into this Vermont and New Hampshire area where they don't have to either test or quarantine because their prevalence is similar to Maine's.
Great, thank you. We're going to turn next to Kevin Miller at the Press Herald.
Great. Thank you very much. Two questions. First one, following up on the announcement on bars. Can either for Dr. Shah or Commissioner Lambrou, can you just talk a little bit more about kind of the reasons for this? I know you talked last week about the cases that were in other states, but at the time there were folks in the industry here who told us, look, we should be doing things differently here in Maine and basically doing what's best here, especially with bars that can achieve some sort of social distancing and spacing within it, as opposed to a blanket, ban on indoor dining, because a lot of these businesses were already getting ready for this and preparing for ways to do it. So can you address that sort of issue?
Sure, I can kick it off from just the epidemiological perspective and then turn it over to the commissioners. From an epidemiological perspective, Kevin, we've seen a couple of things. The first is last week I talked about 2 outbreaks that have been connected to bars, one in Jacksonville, Florida, the other in Boise, Idaho. There are also a few others that we are aware of now that we've been studying, one in Baton Rouge, Louisiana, and then another in Texas as well, that all, again, seem to be connected with bars. Both outbreaks among staff at the bars as well as patrons. So those seem to be growing as we've been studying them and looking at them from a policymaking perspective. They've been instructive. There are, at a high level, the same 2 criteria that we really use to assess any type of activity with respect to bars raise concerns. Those criteria are duration of exposure and the density of the location. With bars, there are concerning signs with both. The duration of exposure can be higher or longer. You're at a bar, you can be at a bar for longer than you might be at a restaurant. And of course, with bars, it can vary greatly what the density of exposure is. It can be completely empty and then 30 minutes later be packed to the gills. In addition, bars by their nature can be smaller, so there's less space to physically distance if you wanted to. But of course, a lot of folks go to bars for the exact reason, which is to not physically distance. Commissioner Lambrou noted face coverings are less likely to be worn because if you're at a bar, you're likely taking sips of your drink. And they can be louder places, which prompts folks themselves to speak more loudly. So it's not just duration and density, it's an expansion of both of those. And so those are the epidemiological factors that we looked at when we were making this policy decision. You noted some of the other considerations that bar owners have noted. I'll turn that over to my colleagues for that.
Sure. And I'll just add what we are doing, because we appreciate the fact that businesses, are struggling in Maine. We know that, we feel that. And what we are allowing, though, is number one, is a bar that's also an eating establishment that has tables, that has waiter services, that establishment can open. We also have really encouraged outdoor dining, or outdoor bars, I should say, because we know that from our experience that it is harder, as Dr. Shah can talk about, to contract COVID-19 when there's breezes, when there's a different type of air circulation. And third, we have actually been working to expand outdoor bars and dining because we recognize the fact that there is a challenge in our current world of COVID-19 with operating in some settings. So we have been trying to figure out ways, safe ways that bars can reopen. And I think we are actually pretty unique in our approach to trying to work aggressively with our different partners in these different sectors to reopen. I think our reopening fares well compared to most states with similar types of epidemiology.
The last thing I'll add on top of that, Kevin, I know you had a second question, is but the outbreaks that we've been tracking in some of these other states have been sizable. In California, in Florida, at last count, it was at least 23 individuals, 16 patrons, and 7 staff members. In Idaho, I think they are now in the low 30s. So these are sizable outbreaks. We're particularly, of course, concerned about the employees in these bars as well. And when you have such a high number of staff members who are falling ill, that heightens the concern we've got. So, Kevin, I think you had another question as well.
Yeah, and just following up on our conversations and comments last week about the racial disparity. When you're looking at I'm sure that you look at the positivity rates, especially the point positivity rates on a local level. And since we know that there are clusters of these cases, especially in Cumberland and Androscoggin counties, near especially around immigrant communities, can you share any of that information with us as far as the positivity rates that you're getting in specific communities, and whether you're still, because it does seem like we're seeing the numbers of minority and ethnic positives are continuing to go up every day in Maine.
They are, Kevin, and we Commissioner Lambrew and I have talked about this at length over the last several months, and certainly more over the last several weeks. We continue to be deeply concerned, and I'll just state at the outset for everyone, neither the Commissioner nor I find any of the numbers we've seen to be acceptable at all. They're categorically unacceptable, and I would say our top priority right now is to try to get things continuing to move in the right direction. I'll talk generally about specifically about the note you raised, Kevin, and then turn it over to Commissioner Lambrew. Now, with respect to positivity rates by county or alternately by race or ethnicity, we're starting to analyze those data now. What we've seen is that the variance by county changes greatly day by day. This goes back to, Kevin, something you and I have talked about. The numbers overall, when you get down to the county level, are pretty small. And so that small daily differences can swing the numbers greatly. So we haven't really seen a clear trend in positivity rates at the county level or at the racial or ethnic level. As we gather more data, we'll probably be able to see different trend lines exist. For example, when there have been large outbreaks, for example, in Cumberland County, the positivity rate has swung quite dramatically. As we've moved out of those outbreaks, it's gone back down. So we don't really quite have enough data to draw firm conclusions, but as testing has been ramping up, I think we will be able to see trends in the near future. Once we've really analyzed that and cleaned it up to make sure it's accurate, we look forward to putting it on the website soon.
Sure. And I'll just add, the COVID-19 pandemic has revealed great acts of humanity and all that is good about Maine people, but it has also revealed deep and painful inequities worthy of our attention. So we have conducted activities COVID-focused as well as broader from, as you all heard last week, we broadened our testing policy to allow anybody with an increased risk of infection to be tested, regardless of whether they're experiencing a symptom. Given our known disparities, this does include people of color. We also have expanded our contact tracing and our supports for people in isolation or quarantine, knowing that these types of preventive measures often are more challenging for people who may struggle with finding affordable housing or may not be able to understand the guidance being given by our epidemiologists. So we have been working with our community action programs, Catholic Charities, Wabanaki Public Health, and others to ensure that we are supporting individuals in taking these critical public health measures. We also have gone outside the circle of healthcare to figure out what social supports people need, from food-related support to psychosocial care, trying to make sure that we are giving people tools beyond the physical housing, but as well as services to ensure that they can take care of themselves in these circumstances. We significantly expanded our coverage through Maine Care to ensure that cost is not a barrier for anybody who might be experiencing symptoms of or needs a test for or needs treatment for COVID-19. We also recognize that this pandemic has significant psychological impacts. So we have, in addition to doing our main frontline warn line for those first responders, many of whom are people of color, we've also translated information on the psychological impacts of COVID-19 into 7 languages that'll be distributed. These are just a few of the examples of the activities that we are taking to try to tackle what we perceive as an unacceptable level of disparities in COVID-19 in Maine.
Thank you.
You bet, Kevin. We're going to turn back to Samantha York. Samantha, are you queued up?
I am. Can you hear me this time?
Yeah, go ahead.
Perfect. Thank you so much. So speaking of testing, I know it's key, but it's getting ramped up here. How concerned are you at this point about running out of test kits or just providing them for all 16 counties at this time?
Samantha, the last part of your question again was providing them for all 16 counties. Is that correct?
Right.
Okay, great. So I'm glad you raised this, Samantha. Let me say three things. The first is, as everyone is aware, or to recap, in the recent few weeks, going back, I guess, 2 months now, Maine has struck 2 significant arrangements with our colleagues at IDEX. The first, the combined effect of those 2 arrangements with IDEX is to be able to, first, to expand our daily capacity right now to up to 1,000 tests per day. We're working on a second phase of that expansion, which will allow just the Maine CDC laboratory to go from that 7,000 or so per week to well above 20, up to maybe 25,000 tests per week. Our ability to conduct such a large number of tests is a function of IDEX's incredibly deep bench at being able to manufacture these test kits. So as a result of that, we believe that even right now, but certainly as we expand and look into a fall when testing might be more commonplace or the later summer for tourists as well as students, we believe that this expanded capacity will well position Maine to handle the demand for tests as it grows. The second piece, Samantha, this might just be a bit of terminology, but I think it bears clarification. When we talk about test kits, what we're referring to is a box of chemicals and reagents that we got from IDEX that is used exclusively at the Maine CDC laboratory. So we don't provide tests to the counties. Rather, the counties send us samples that are drawn by people by using the nasal swabs and things of that nature. The test kits themselves are what are utilized at our laboratory to analyze and actually conduct the test on those samples. And the bottom line there, again, is that because of IDEX's strength in the human and in the diagnostics world generally, we believe that the partnerships that we've arranged with them will provide us a very strong base on which to offer testing. Right now, we are not worried, to be frank, about our ability to provide testing either right now or as we go into later in the year. I'm going to turn back to Brian Sullivan at WABI.
Yeah, thank you, Dr. Shah. We've been speaking with an elder care facility here in Bangor, and they said they've been working with the CDC to allow some outside visitation, and just why you felt, or the CDC felt, now was the time that would be okay, and what that will look like.
Sure. I can start on the epidemiological side and hand it over to the commissioner. Brian, as we've talked about at these meetings, as Commissioner Lambrou noted a moment ago, in recent weeks, there have been increasing amounts of data that have come out about the relative risk of indoor activities versus outdoor activities. And virtually all of the signs have pointed to a lower risk from any type of outdoor activity, especially if that outdoor activity is one where face coverings are worn by everybody involved and physical distance is maintained. When you combine those three things, physical distance, face covering, outdoor activity in the sun, spaced away, as well as hand hygiene, the data seem to suggest a much lower risk of COVID-19 transmission. In light of those emerging data, we felt that it was acceptable for certain facilities to allow visitation to occur out of doors. Now, this visitation doesn't mean that it can be close. The rules still require all members involved, the residents as well as their visitors, to have face coverings on. They've still got to maintain that physical distance because we're still worried about the introduction of COVID-19 into long-term care facilities, into assisted living facilities. But we've simultaneously heard and have known all along. In fact, I think at one of the very first press conferences we had way back when, we acknowledged the concern we had about turning an epidemic of COVID-19 into an epidemic of loneliness, especially for residents in long-term care and assisted living. So we've always been looking for solutions to try to reduce the impact of loneliness on the residents in assisted living facilities. Given the emerging data on the relative safety of outdoor visitation, we felt comfortable moving in that direction. I'll just say this last thing before I turn it over to Commissioner Lambrou. The operative term there is relative safety. There is still a risk involved even with outdoor activities. And we urge everyone before they're going to visit their friend or family member to keep those risks in mind. If you're not feeling well, if you've got a cough, if you're not sure what it is, the risk to outdoor activities is lower, but it is not zero.
I'll just add 2 points. One is that we have to remember that through May, 24% of COVID-19 cases in Maine were associated with congregate living facilities, including residents and staff. So we do know we have an elevated risk for these types of settings. We also know that it's important to look beyond just the nursing facility to, as Dr. Shah mentioned, assisted living, also our group homes. So we have completed our outreach levels to different types of congregate living facilities. We posted on Friday the results of those surveys. We will continue week in, week out to work with these sites to both protect residents, protect staff, but also ensure that those individuals have the connection with their family and friends that is so critical to their mental and physical health.
And the last question for the afternoon goes to Megan from WMTW.
Dr. Shah, my question is for you. It goes back to the outbreak identified in Houlton. I understand that there are the testing site or a testing site is set up. There's 3 days where people can go. Do you have any idea the size and scope of how many people may have interacted with these EMS workers and others that fall within that time period?
Yep. So Megan, thanks to the great record keeping by Houlton Ambulance Service, we do have a sense of all the individuals that these 2 particular EMS crews interacted with. We'll get you the exact number, but I'm glad you raised this because the approach that we're taking in Houlton is really truly a belt and suspenders approach. We're doing 2 things at once to keep people in the community safe. The first is that we're reaching out to every single person on that list to see if they've got any symptoms and urge them to get tested. But because we wanted to cast the widest net as possible, recognizing, as I think you noted, Megan, maybe there were other individuals that the positive cases interacted with that were not as part of an EMS run. We also wanted to alert the public generally and ask them to get tested at this community testing site. So we're doing both. We're going to be individually reaching out to every single one of those folks. We'll get you what that exact number is. But then we also wanted to cast an even broader net to make sure that anyone who might have been affected, who might have been in close contact, it gets testing. The last thing I wanted to clarify is that our investigation is underway right now. And as of this time, we don't know who the initial patient was. In some cases and outbreaks, the temptation is to think that the first case that you know about was the first case in the outbreak. There's another similar temptation in outbreaks, which is to think that all the cases you see are all the cases that are there. In this outbreak situation, we're not sure if the first case was the actual first case or whether the transmission went the other way. The second is that in outbreak situations, there can often be someone who connects two people that we don't know about yet, a literal missing link. So we're still investigating where the outbreak may have started and how it may have transmitted from person to person, the so-called chain of transmission. As we learn more about that, we'll make sure we provide updates to folks. So with that, those are all of our questions. Commissioner Lambrou, anything further from you? Great. Well, I thank everyone for dialing in and tuning in this afternoon, as you all have done over the past several months. We very much appreciate everyone joining us to hear the latest on the COVID-19 situation in the state of Maine. We hope everyone has a lovely afternoon. As always, be kind, take care of one another. We'll catch up again on Wednesday. Thank you, everyone.